the force be with me, let's go. Side-eye. I get this a lot at parties. The problem is that I know a lot about climate change, and so people ask me questions about climate change, and I give them honest answers about climate change, and my friends have children, and I scare their children with my honest answers, and so I get side-eye. I'm going to be honest with you here. Climate change is very scary. If you're paying attention to the news these days, you're seeing words like climate crisis, climate emergency, climate breakdown. These are absolutely the right words to be expressing where we are right now. This is a plot of temperature projections for British Columbia over the next 80 years. Let me assure you that we are, as a global community, on that red path. But even if we stopped all carbon emissions tomorrow, there would still be heat baked into our future here. My hope for healthcare is that we can adapt to these changes as quickly as we need to. The climate is changing now. This isn't something that's going to happen in a distant, scary future, and it is affecting the health of British Columbians. Before I go further, I want to acknowledge that it is affecting people in the north first and worst. This has implications for the way of life of Inuit, Métis, and Indigenous people. It's yet another insult. This individual cannot go hunting out on the sea ice because there is no sea ice. When I think of climate change, I think of 5 riders of the apocalypse. They are heat, drought, wildfire, extreme precipitation, and sea level rise. All of these riders came galloping together through British Columbia in 2021. It started with one of the most extreme heat domes ever recorded on the planet. We had temperatures that were 25 degrees higher than they normally are. They lasted for days. Weeks later, international scientists said this event had been caused by climate change. This is my studio apartment in a modest building in East Vancouver. It was 38 degrees in here when I arrived home on June 28th. And so I put the cushions from the couch out on the balcony so that I could try to get some sleep, but I couldn't get any sleep because I just lay there and listened to sirens screaming all through the night, and I knew in my heart what was happening. Hundreds of people were dying in their homes because it was too hot. Those green lines are deaths in British Columbia on a normal day. Those orange and red lines are deaths in British Columbia during the heat dome. We are so lucky that this event did not last for weeks rather than days. This is the town of Lytton, British Columbia. It set national temperature records 3 days in a row on June 27th, 28th, and 29th. On June 30th, it burned to the ground. 2 people died. Hundreds of people lost their homes and their community. This kicked off one of the most extreme wildfire seasons the interior of the province had ever seen. As the meteorological conditions of the heat dome broke down, it caused lightning storms. There were tens of thousands of strikes in the province and some very near misses in some of our larger communities. Those wildfires were able to burn because we were in some of the deepest drought conditions the province had ever seen since we started measuring drought in the early 1800s. Some farmers report losing more than 80% of their crops. Not only does this devastate the lives of individual families, it puts our food security and nutrition at risk. This is rainfall as it's supposed to look in 2100. The blue areas get more rainfall than they used to. The red areas get less. You'll see that there is more rainfall expected along the coast in the province. That happened in November of 2021. We had the most extreme rainfall event the province had ever seen. The soils were weak because of the drought and the wildfires, and the rain fell on snow that had already fallen in the mountains, and all of that water came gushing down our beautiful mountain valleys, and it wreaked chaos. The Lower Mainland was cut off from the rest of the country for days. People were cut off from their healthcare services. This will happen again It is not a question of if, it is just a question of when. Finally, we get to sea level rise. This is what Greater Vancouver is supposed to look like under a king tide in 2050. That is 30 years from now. This has implications for where people can live, where we go food, and where we can put our buildings. We're currently building the new St. Paul's Hospital complex at the mouth of False Creek. This area is going to be subject to higher tides and storm surge. That building needs to consider those conditions to be safe into the climate future. I want to come back to this question of the mental health of young people. This is actually where I expect the biggest impacts of climate change to be in the years ahead of us. They have not had the time that we adults have had to start adapting to this news that they're hearing. If you're not familiar with your internet memes, these are doomer and bloomer. Doomer has given up all hope. He thinks all the cause is lost. Bloomer maintains hope in the face of adversity. And I know that I sound like doomer here, I really do. But I am a bloomer. I think that all hope is not lost, but I think what we really need is social connection. That is the thing that is going to save us. The pandemic has driven us apart in a way that nothing has ever driven us apart before, and we need to come back together to face what lies ahead. Thank you.